I'm Dustin Hardwick, a physical therapist with a PhD in movement science. In this first episode of the Movement PhD, we'll introduce the movement system and review key concepts and terminology. Whether you're revisiting foundational concepts or exploring the movement system for the first time, this episode will get us all on the same page before we dive deeper in future sessions. On YouTube, you'll see slides appearing in sync with the audio. If you're listening on another platform, the visual aids and full transcript are available on my Substack. Whether you prefer listening, watching, or reading, offering all three formats supports better retention and a deeper understanding of the material. Check the episode description for the links. All right, we have our slides pulled up, so let's get started with Season 1, Episode 1, Introduction to Movement. Before we talk about movement itself, we should define what the movement system is. When you think about movement, you probably already think about the musculoskeletal system, so your muscles, your tendons, and the bones that they attach to. You may think about the nervous system, your brain, those spinal nerves that innervate and activate those muscles. But also realize the endocrine, cardiovascular, pulmonary, and tegumentary systems are also part of the movement system. So for this podcast, we'll spend most of our time on the musculoskeletal system. Before we start talking about planes and different types of movement, let's get a home base here. Our home base for all of our movements is going to be anatomical position. So this is standing with your feet forward and your palms facing forward. So the standing, feet forward, that probably makes sense. We don't usually stand with our palms facing forward, but that is going to be our reference point from now on. So if I say something is anterior, posterior, superior, or inferior, I'm really referring back to this anatomical position. So let's dive into the planes. The first plane that movement occurs in is the sagittal plane. So this one name is a little bit different, but realize it is the plane that cuts the body into a left and right part. Think about a plane that is bisecting your body into a left side and a right side. So the axis, that is the point by which your movement occurs, is going to be perpendicular to that plane. And by perpendicular, I just mean that axis pierces right through that plane at a right angle. For sagittal plane movements, the axis is going to be a medial lateral or simplified to a lateral axis. So examples of movements in the sagittal plane, for the upper extremity, a dumbbell front raise. So imagine you lift your arm in front of you, lift a dumbbell or just your hand. That's movement in the sagittal plane about the mediolateral or lateral axes. Other movements that occur in the sagittal plane, you may be doing that right now. So if you're listening to this podcast while you are walking, while you are running, or you're taking the stairs, those movements primarily occur in that sagittal plane. So as you take your step forward with, say, your right leg, that's going to be flexion because it's moving anterior. That flexion of your hip occurs in the sagittal plane about that lateral axis. If you're picking your foot up to put it on a step going up the stairs, that is also hip flexion. That is a sagittal plane movement occurring about that lateral axis. So to review that, it divides the body left and right. The axis is lateral. Movements are flexion and extension. So whenever we talk about flexion and extension in this podcast, it's going to be a sagittal plane movement. The next cardinal plane is the frontal plane. This one's a little bit easier to remember because this plane cuts the body into a front and a back part. Again, your axis is going to be perpendicular to that plane. So for an axis to pierce that frontal plane at a right angle, it has to come from anterior to posterior. So we refer to that as an antero-posterior, and I'm just going to say AP because it's really hard to say antero-posterior multiple times. Movements that occur in this frontal plane, abduction, from now on I'm going to say abduction because it can be hard to hear the difference, and adduction or adduction. These are the movements that occur in that frontal plane. The easiest way to demonstrate the frontal plane, if you're not sitting in a car, if you're somewhere where people aren't going to look at you weird, just get up and do a jumping jack. Every part of the jumping jack occurs in this frontal plane. Your shoulders are moving on the up phase into abduction, and as you jump, your legs going out is also abduction. So abduction is movement in the frontal plane about that AP axis away from midline. So the up part of a jumping jack, both your leg and your arms are doing abduction. And as you return back, your arm to your side, your leg to touch the other legs, that's adduction. That's movement towards midline. So whenever we refer to abduction or adduction, that is a frontal plane movement. It's about that AP axis. The final plane is the transverse plane. The transverse plane divides the body into an upper and a lower part. Therefore, that means the axis for this has to be vertical or longitudinal. In the textbooks, you'll see both vertical and longitudinal. Both of those mean the same thing. We're taking an axis from the top to the bottom, and it's piercing through that transverse plane. So movements that occur in the transverse plane, these are our rotational movements. Internal, external rotation of the shoulder is an example of a transverse plane movement. Rotation of the trunk is also transverse plane movement. So examples of movements, Russian twist, if you've ever done a Russian twist for your abdominals, that's primarily occurring in that transverse plane. Let's talk about the kinematic chain. Movements can either be open chain or they can be closed chain. In an open chain movement, the distal, or the segment that's furthest away from you, is free to move, which gives you more options for movement. An example of this would be a leg extension. So either weighted or unweighted leg extension is a good example of an open chain movement. Another way to conceptualize the idea of an open chain is that movement at one link does not affect other segments. So you're probably thinking, what does that mean? So let's look at that a little bit more. If you think about the different joints in the leg, the knee is one link, the ankle is another link, and the hip is the final link. It means that if I move my knee, it doesn't force me to move my ankle or my hip. So if you're doing a seated leg extension, as you extend your knee, you're not forced to move your ankle. You're not forced to move your hip. You can isolate that movement at that one joint. So that's what we mean by open chain. The other type of movement is a closed chain activity. In a closed chain activity, the distal segment is fixed, meaning that the options for movement are restricted. So what does that mean? It just means the foot is planted on the ground, your hands are planted on the ground, so they can't move. The easiest example is a squat. So as you squat down, your legs are planted on the ground, meaning that that ankle has to move at the same time that those knees and those hips move. So another way to then say that is the movement at one chain determines the movements of the other segments. So looking at the squat, as you go down in the squat, that's knee flexion, you have to also flex your hip. You also have to dorsiflex your ankle. It would be impossible to maintain balance while flexing your knee without flexing your hip and your ankle. So that's what we mean by a closed chain activity. The distal segment is fixed against the ground or some other surface so that when you move one segment, the other ones move as well. I'm going to leave you with one question. Based on these definitions, how would you classify a leg press? As we describe movement, we can describe both the movement that we can see with our own eyes, which are osteokinematic movement, and the very small movements that occur between the joint surfaces that we can't necessarily see, but nevertheless, they're just as important. So let's break that down a little bit. Osteokinematics, these are motions of the whole segment. That's motion that we can see with our own eyes. Earlier when I talked about flexion, when I talked about extension, abduction, adduction, all of those movements are examples of osteokinematic motion because it's movement of the whole segment relative to the three cardinal planes. And that's pretty intuitive. Whenever you watch somebody move, what you can see, that's osteokinematic motion. Arthrokinematics are the passive accessory movements that accompany that osteokinematic motion. So every time you extend your knee or flex your knee, the bones aren't just moving in space, the joints are also moving relative to one another as well. So example of arthrokinematic motion is roll, is glide, is spin. Where you might have seen this before is if you've ever had manual therapy, whether it is immobilization of your spine, of your shoulder, or a manipulation to get a crack of your back, that motion that's occurring during that manipulation or that mobilization is that arthrokinematic motion. That's movement between the joints. So these arthrokinematic motions, you can't see them, but they're just as important for healthy movement. And we'll talk about the relationship between arthrokinematics and osteokinematics on the next slide, and we'll go over some pretty important rules. Convex-Concave Rule. If you want to bookmark a part of this to come back to, because I think this is a concept that, at least my own experience with students, it takes a few tries to really understand. So what we're talking about here is how to determine what the proper arthrokinematics are for a joint, depending on how that joint is organized. So I'm going to have you, no matter how confident you are, how many times that you do this, I want you to follow these steps exactly. So the first thing is to determine which segment is moving. We're going to use our knee example for this one because I think it's most relevant and probably the easiest to think about. So during a closed chain knee extension activity, what segment is moving? It's the femur. So question number one, what segment is moving? So in this case, it's the femur. The second question I want you to ask yourself is the distal aspect of that segment, is it convex? And convex just means round. So is it a rounded end? Then it's a convex. Or is it concave? Concave just being a dish or a concavity. So in this convex-concave rule, when a convex surface is moving on a concave surface, the roll, which is the arthrokinematics, and the slide are going to be in opposite directions. When you have a concave surface moving on a convex surface, then the roll and slide are going to be in the same direction. So let's bring it back to the knee, and we'll do it for both examples. First example, a squat. From the bottom position to the top, so if I get up from this chair right now, that's going to be closed chain knee extension. So in this case, I ask myself, what segment is moving? It's the femur. Is the femur convex or is it concave? Well, the end of the femur is rounded, so it's convex. So now I know that I have a convex surface, femur, moving on a concave tibial plateau. So therefore, I know that the roll and slide are going to be in opposite directions. Now I ask myself the final question, which direction are we moving in? In extension, the femur is moving anterior, which tells me that the roll is going to be anterior. And because of the rule, now I know that my slide is posterior. So from the sitting position to standing, I'm going to have an anterior roll and I'm going to have a posterior slide. So that's for the squat, which is a closed chain activity. Now let's go through that same process for open chain knee extension. So I'm sitting in this chair and I extend my knee, or I'm sitting on a leg extension machine and I extend my knee. So what segment is moving? It's the tibia. So the distal portion is moving. Is the tibia concave or convex? Well, the tibia is concave. It's shaped like a dish on its superior plateau. So what's the rule? Concave on convex. The roll and slide are going to be in the same direction. Now I ask myself that final question. I have the rule. Now I ask myself the directional question. In this case, my tibia is moving anterior. So therefore, I know my roll is anterior, and because of the rule now, roll and slide being the same, slide is also going to be anterior. So now it's your turn. I want you to reverse this. Think about the down movement. I'm standing and I sit into a chair, or I put the barbell on my shoulder and I go into a deep squat. What is the rule there? What is the direction? I'm doing a lying hamstring curl, which is open chain knee flexion. So think about those to yourselves. Put it in the comments if you have any questions. Earlier, I mentioned that these arthrokinematic motions are needed for proper movement of the whole segment. So what happens if we have impaired accessory motion or impaired arthrokinematics? So if I go into shoulder abduction, which is raising my shoulder in the frontal plane, appropriate accessory motion is superior roll with an inferior slide. Because the humerus is convex, it's moving on a concave glenoid, therefore the roll and slide are going to be opposite. But oftentimes with the shoulder, we don't necessarily get that slide that we need. So what happens? We keep rolling superior, and without that slide, that humeral head just rolls right into that subacromial space, and it impinges upon that subacromial bursa. So shoulder impingement, if any of you out there have had shoulder problems, you had a diagnosis of impingement or rotator cuff impingement, it's most likely because your humerus wasn't getting that inferior slide that it needs. Let's talk about how we define muscles and parts of muscles. So the origin is the more stable, fixed, and usually more proximal attachment of a muscle. The insertion is usually the more distal attachment point of the muscle. And in general, as you contract a muscle, it pulls the insertion towards the origin. So using the biceps and elbow joint as an example, as I go from full extension to full flexion, I'm moving the insertion of my bicep, which is a couple of millimeters off of my elbow, on the radius towards its proximal insertion, and that is flexion of the arm. So there are some people that prefer that proximal versus distal attachment just to take the biases out, recognizing that muscles can move in either direction. But for simplicity in this podcast, I'm going to use O's and I's. Muscles can be either a single or a multi-joint muscle. These are the muscles that cross only the joint that it acts upon. Some examples of that is the soleus, which only crosses the ankle joint. It's a plantar flexor that is a single joint plantar flexor. And going back to our example of that elbow flexion, the brachialis muscle sits right underneath the biceps. The biceps get all of the glory and all the show, but the brachialis, which sits right underneath that biceps, is really the powerhouse of the elbow flexion. Because that brachialis, it only crosses that elbow. Again, using similar example as I gave for the single joint muscle, the gastroc is the two joint muscle that crosses the ankle, because it crosses not only the ankle joint, but it also crosses the knee. So therefore, if my knee is in some flexion, that gastroc is not going to be able to work as well because it's going to be too short. It's a good thing we still have that soleus, which is the powerhouse of ankle plantar flexion, to then produce that motion of plantar flexion. Going back to our example of elbow flexion, your biceps crosses more than one joint. It crosses the elbow joint, it attaches to the radius, which allows it to move into pronation, supination. So it kind of crosses another joint there, but it also crosses the shoulder joint. Your biceps is also a shoulder flexor. So if you're doing an elbow flexion exercise and your shoulder is in flexion, that biceps is not going to be able to contribute as much to that elbow flexion because we have shortened it over that proximal attachment. So when you're doing a curl up here in shoulder flexion, that's primarily working that brachialis underneath that biceps brachii. So to kind of summarize this, and I'll talk about this in our regional units at length, single joint muscles, they only cross one joint. So therefore, they are usually the powerhouse for moving that joint, since the position of the other joints around it do not affect it. Let us talk now about contraction types. So an isometric contraction is tension that is developed within the muscle, but the joint angle itself remains constant. So what does that mean? It just means that you're going to hold against gravity without moving. So an isometric exercise would be holding your arm out to your side in abduction without moving. My deltoid is contracting, so it's generating tension, but the angle of the joint itself is not moving. A concentric contraction is developing tension in the muscle as it shortens. So this is usually against gravity, but it could be against a different resistance, but gravity is our most common one. So whenever you develop tension within a muscle and that muscle is shortening, that is a concentric contraction, usually the up phase of a movement. An eccentric contraction is tension as the muscle is lengthening. So that's movement is usually with gravity. So think about slowly lowering your hand from full flexion to extension. That is eccentric contraction of those elbow flexors. If you've been working on your bench press and you're trying to increase your ability to push a bigger weight, you'll often do some slow negatives. So a negative is an eccentric contraction. Let's talk about these different types of muscle contractions related to their force production and their energy requirement. Concentric, so that's that shortening contraction, has the least ability to produce force. So you're going to be the weakest on the up phase of a movement. And it's going to require the most energy to complete that concentric contraction. Whereas our isometric, which is tension is being developed, but the joint is not moving, that's a moderate amount of force production and a moderate amount of energy requirements. So it's kind of in the middle. Our eccentric contraction, this is where we can develop maximal force production with the least amount of energy requirement. So if anyone here is a weightlifter, you know that you can slowly lower a weight that's 20 to 30% greater than you can push back up. So I'm going to use that bench press because it's easiest to conceptualize. If you can bench 200 pounds, you can probably do a negative with 240 pounds for a couple of reps. That's because your force production for that eccentric or that negative is the greatest and that energy requirement is the least. So keep that in mind, use it in your training. That's really the whole idea behind using negatives to increase your strength. Relationships of muscles. The agonist, these are the muscles that are contributing the majority of the work. So I'm going to use that elbow flexion example because it's the easiest to show. As I'm doing elbow flexion concentrically, the agonists here are our biceps brachii and our brachialis, also a brachioradialis. These are the muscles that contribute the majority of the work. The antagonist is the muscle that opposes that prime mover. So another word for agonist is prime mover. The antagonist in this case is going to be triceps because they're opposing that movement of that agonist. So agonists are the movers, antagonists are opposing that movement. Synergists are just small muscles that aid in the performance of that. So in order for me to do this elbow flexion, I also need to stabilize my humerus. So my rotator cuff muscles, any muscle that crosses from my scapula to my humerus that stabilizes it is going to be a synergist for that movement. So synergists are just muscles that aid in the performance. There's several different types of these. I'm not going to get into all that right now. I'll talk about it more when we get into our regional units. All right, we've talked about classifying movement, planes, different types of contractions. Let's talk a little bit about the forces. So this is a podcast about movement, so I'm not going to get too much into the physics, but we'll talk just a few things that I think are important as we move into the regional units and talking about how the body organizes movement. So when I say a force is just mass times its acceleration. The things to realize here is it's a vector. So a force has both a magnitude and a direction. So that's going to be important when we start talking about how muscles work together to produce movement, because each of these muscles are going to have a force that is both a magnitude, how much, and a direction, in what direction is that force directed towards. So therefore, it has a spatial orientation as well as a point of application. So for muscles, the point of application is always going to be that insertion. So it's going to be represented as a force vector. So throughout this podcast, I'll refer to line of pull of a muscle. When I say that, I just mean the force vector of that muscle. So that's all I want you to recognize about forces. It's mass times acceleration. It is a magnitude as well as a direction, and it's applied at a specific point, which for muscles is going to be the insertion. For external forces like the barbell, the application is going to be wherever that weight is at. If it's gravity, it's going to be the center of mass of that segment. That leads us to our next topic, internal versus external forces. An internal force is a force generated within the body. So the most common internal force is your muscle force. There are other internal forces, joint reaction forces, Coriolis forces that are generated as well. But for simplicity, we'll mostly be talking about internal forces being the muscle contraction for this podcast. The external forces are generated from outside the body, so they're external. The most common one is gravity. Because they act as vectors, when you have multiple muscles acting on one segment, those force vectors sum. So they sum by taking the beginning of one force vector and putting it at the end of the other force vector, so head to tail method, and get a resultant force vector. I think seeing this visually will be helpful. It's kind of hard to explain without an image here. Quick note here, head over to my Substack to get the slides. So basically, as we click through this, we can see that we took one of the force vectors and put it to the tip of the next one. And now by summing these two vectors, I get a resultant force vector. So let's kind of take that in more practical applications. At the knee joint, your quadriceps attaches to your patella through its tendon, and that is one force vector. And then your patellar ligament then attaches to the tibia, which was another force vector. So basically what I did here in this example, this illustrated example, I took the force vector from the patella to the tibia, I moved it to the end of the force vector from your quadriceps tendon, and I summed those two, and that green arrow becomes the resultant force vector that allows your quadricep to extend your knee. Without your patella, and without that patellar ligament, your quadriceps would only pull your patella up. So we need both of those force vectors for that knee extension to be caused by the contraction of that quadricep. And we'll talk a little bit more about this. Another example, your gastrocnemius has two heads. I have two different force vectors acting either medial with a medial head, lateral with a lateral head. But when I take the force vector from the lateral head and I put it on top of the force vector from the medial head of the gastroc, I get this resultant force vector, which is straight up. So that causes that pure plantar flexion. And one upper extremity example, your deltoid has a pretty much superior line of pull with your arm down at your side. So if you contract your deltoid alone, your arm is not going to go into abduction. You need help from that supraspinatus tendon, which has a more horizontal force vector to cause that pure abduction. When I contract them both at the same time, I can sum the force vectors of my deltoid and my supraspinatus. Now I have a resultant force vector that produces abduction of the shoulder. This one has a very good practical application. If you have a torn supraspinatus and you go to abduct your arm, you're not going to get abduction. You're going to get your humerus being pulled superior. So what you'll see patients do is lean to the other side, which then allows that deltoid force vector to be more horizontal. Now they can do abduction of the arm. I alluded to moment arms earlier. Your moment arm is the perpendicular distance from the force vector or line of pull of a muscle to the instantaneous center of rotation of the joint. So what's important here is it's the perpendicular distance between the vector and the center rotation, not the absolute. It means that it changes. The point of application of the muscle doesn't change. So I'm going to use my bicep again. As I go from full extension to full flexion, the moment arm of my bicep changes because it's a perpendicular distance between the line of pull of the muscle and the elbow joint. But my biceps doesn't move on my forearm. So the important thing to remember here is the perpendicular distance. So if I'm holding my arm at 90 degrees, the perpendicular distance between the instantaneous center rotation of my elbow and the line of pull over my biceps is going to be the greatest at 90 degrees. As I go towards full flexion, that moment arm or that perpendicular distance decreases. And as I go towards full extension, that moment arm also goes towards zero. Levers are going to be the last thing that we talk about in this introductory discussion. A lever is simply a fulcrum with a resistance arm and an effort arm. I'm going to apply this for our human body. In our case, the fulcrum is going to be the joint. The effort arm is going to be the moment arm of the muscle. The resistance arm is going to be the distance between the application of an external load, whether it's the center of mass of my arm or whether it is the distance from the coffee cup I'm holding in my arm to the elbow. The relationship between these determines the type or class of lever, and we'll go through each of those levers in turn. One other term that I want to talk about a little bit is mechanical advantage. It's the ratio of effort to resistance arm. So a mechanical advantage greater than 1 means that the muscle gets the advantage. A mechanical advantage of less than 1 means that gravity or the barbell or the resistance band gets the advantage. And a mechanical advantage of exactly 1 means that the system is in perfect balance. First class levers. This is where the axis is located, or the fulcrum, between the force and the resistance. This system is designed for balance because it requires low effort to maintain that stability. In this case, the mechanical advantage can be exactly 1, but could be greater or less than 1 depending on where the two forces are applied. Easy example of a first-class lever in the human body is the head. So in this case, the axis or the fulcrum is right behind the ear, and the force of muscle or the effort arm is your capital extensors, and the weight of the head is going to be the resistance. In this case, the mechanical advantage is slightly towards the weight of the head. So if you've been listening to my discussion here and you fell asleep, you probably noticed that your head tipped forward. That's because the weight of the head has a mechanical advantage over the force of the muscles. Second-class levers. In the case of a second-class lever, you have an axis or a fulcrum on one end. You have the load or the weight of the segment in the middle, and then you have the muscle furthest away. Because of this, the moment arm of the muscle is greater than the resistance arm of the load. Therefore, the advantage in force generation goes to the muscles. The simplest example of this in the body is your calves and the weight of your body. So if you go up onto your toes in plantar flexion, you're doing a calf raise. The axis is at the ball of your met head. The weight of your body is about at the ankle, and then your calves are further away. Having this second class lever gives a mechanical advantage to your calf muscles, which is a good thing. Your calves are relatively small compared to the rest of your body. Finally, we have third class levers. In this case, we have an axis at one end, the muscles closer to the axis, and then the resistance arm further away than the muscle. So in this case, the mechanical advantage is less than 1. So your muscle does not get an advantage in force production. The advantage goes to the resistance. However, because it is closer to the axis, a little bit of contraction of that muscle can cause a larger angular rotation of that segment. So a third class lever optimizes range of motion. And this is the most common lever type in the body. So let's go back to our example of the elbow. In the case of your elbow, you have your fulcrum being your elbow joint. You have the application of your bicep very close to that elbow joint, but the center of mass of my arm is way out here. So this is a third class system because the muscle moment arm is smaller than the resistance arm of the segment. So I'm going to leave you with a question, and we'll answer it in subsequent sessions here. What are some other examples of third class levers? Let's think about some at the hip and the knee. Thanks for tuning into this first episode of the Movement PhD. I appreciate you being part of this conversation as we lay the groundwork for exploring the movement system together. If you found this helpful, please subscribe to the podcast and follow me on social media. And if you have questions on anything we covered or want to hear about a topic you're struggling with, leave me a comment. Next time, we'll break down the gait cycle, covering spatial and temporal descriptors, as well as the phases of the gait cycle. Thanks for listening, and I'll see you next time.